back, I'm trying to single out anybody, there are so many, but I have to tell you, even before I arrived in 2002, Jim Callis had been thinking about what a foundation for the hospital for healthcare could mean for this region. Jim dedicated many hours, did research, was very instrumental in pulling together the first group of community leaders, including Paul Byker, David Lake, David Floyd, Mary McLaughlin, Joe Bodie, Sean Pilliard, several others who actually came together, began developing bylaws, developing policies, and really making this foundation become a reality.
Mary McLaughlin was the first president of the foundation. She served 1 year, and then David Floyd came in, and that's all history. What a wonderful leader for 8 years of the foundation.
When I look back over the 10 years, I can't help but think of the awareness and the credibility that we've helped bring to the whole healthcare community in Sedalia through the foundation. We've been a promoter, and we've done that by linking with individuals, sharing their stories, hearing their successes, sharing their pain, and what better connection than that over the last 10 years. I'm just very humbled by what we've accomplished.
All you have to do is walk around the hospital here and you see what that impact. Of course, the Cannon Center we're in right here today is part of that impact that we've had. But in cardiac rehab, in various areas, women's health, in the nursery area, just the emergency room, everywhere in the hospital you see the results of the fundraising and the effort put forth by the foundation and the people involved.
Well, the Expert Swing is a dynamic piece of technology that was acquired through the Foundation's gracious efforts to help provide patients with less radiation, a more accurate test, and actually puts us at the forefront of cardiology here in Sedalia.
I've been blessed to work with so many great people, Charlie Marshall and Shirley Evans, and people from out of town. It's just been tremendous. And one that sticks out in my mind is Jim Callis, who really has a heart for Bothwell. He's a long-serving chairman of the Board of Trustees and a local member who's given so much to the community. And I personally depended an awful lot on him as for his insight into the hospital, into a foundation. And they started the Cami Callis Gaspard Fund with the foundation, one of the very first large donations we received, and we were honored and humbled by that, as they wanted to remember a family member. And Jim's knowledge and his heart for the community meant so much to us. And thank you, Jim, for your insight and your love for Bothwell.
Jim, I'll never forget the way I felt and the way I was moved seeing you in the emergency room in July of 2002. I admire you for the way that you have turned that tragedy into a very positive, influencing legacy that will stand the test of time and that will continue to provide resources and awareness so that that tragedy doesn't happen to somebody else in this community.
And I realize that every day in this institution, 90-some% of the people in this area are touched one way or another. A family member, a new baby, a person chemo, a heart issue. Every day that happens. And so when you have an opportunity to give to this type of donation to the foundation, keep in mind that every day people are going to be touched that are your friends and neighbors. What kind of an impact is that on your life?